Hello, this is Dr. Bill Rawls with a CBD question. What's the correct dose, or how much CBD should you be using? And the answer really depends on what you're using it for. What I'm finding personally in using it and using it with customers and patients is that you get different effects with different dosages. So if you're looking for just enhancing wellness and just the day-to-day grind of getting through the day, a really small dose of 10 to 20 milligrams, maybe just a half a dropper full or a dropper full of most preparations, is enough to give you what I call an adaptogenic effect. In other words, it's helping you deal with stress. It's helping you to become more buoyant. It's keeping your immune system pumping, and that's all you're going to need. The science is showing that CBD from hemp, or the hemp form of cannabis, boosts the normal receptors in the body for what we call endocannabinoids, the neurotransmitters or signaling agents in our body. So we're boosting the receptors and we're boosting the natural substances in our body with CBD. So if you take a little bit, you get that enhancement on a daily basis. That seems to be, the longer you use it, the more benefit you get. And of course, that's going to level off at a certain level. If you're trying to treat a situation involving pain, like chronic back pain, chronic joint pain, recovering from a chronic illness, you may need a good bit more. And the thing to do is titrate your dose up. Start with a lower dose of 10 to 15 milligrams, but you can increase it from there. Some people are going to need upwards of 300 milligrams a day, and the only downside of that being that it just starts getting expensive. But it's a really nice substitute for narcotics and other pain relievers because it doesn't really have any negative side effects. It does not appear you can get habituated to CBD, and one of the really important effects is that you can't really hurt yourself badly with CBD. Unlike narcotics, unlike benzodiazepines with Valium or even alcohol, it's hard to overdose with CBD because it doesn't cause respiratory or cardiac depression. You know, you take too much of a narcotic, you drink too much, it can stop your heart and stop you from breathing. Cannabis, all of the different forms of cannabis will not do that. So even higher doses may make you feel agitated or just not feel good, but they can't do any long-term harm to you. So for most people, it's going to be in a dose range of 10 to 15 milligrams once a day, up to 3 times a day, up to 50 milligrams to 100 milligrams 3 times a day. Some people are probably going to have to use higher doses than that. Now, I think really what's important to know here is that we're talking about the herb cannabis, the form of cannabis called hemp. So you're not getting just CBD, you're also getting other cannabinoids and you're getting terpenes, which enhance the effect of the CBD, so you don't need as much. And that's something that's really interesting. There are CBD drugs out there now that are isolated CBD. All that comes in there is the CBD without all the other things that come in the drug. And what they're finding with the drug is that most people need doses of 750 to 1500 milligrams a day to get any effect at all. So all those other things that come in cannabis, the whole herb, appear to be really important to get the full effect. That you're just not going to see with some of the purified versions of CBD. So for more information like this, I've written a very thorough blog that's posted on my website, Rawls MD. There's lots of information about CBD and cannabis, but also other topics too. While you're there, please sign up for the newsletter that really has lots of great information coming to you regularly. Take care. Have a good day. Hey, thanks for watching. And if you like this video, please subscribe to my channel. Take the time to leave comments, ask me questions, let me know about other things that you would like to hear about. Thank you.